Hello, everyone. Hello, everyone. Welcome back to those of you who are joining us for the first time. We welcome you back. So we are super excited to begin the second part of our day. We hope everyone had an opportunity to grab something to eat. If you were like me, you were participating in a wardrobe change. So Ruthie, this one's for you. But we are so excited. So just an FYI, we welcome your feedback on all aspects of this conference. And so you will see that after each breakout session, we will be sharing evaluation forms, and then we will be sharing them for the overall conference. So we do ask that you all participate in creating those and putting your information in those evaluations. So we are going right into our afternoon plenary. Today's plenary will be about expanding programs and collaborations for successful reentry. We do apologize that due to a change of schedule, Director Rob Jeffries was unable to join us today, but he has left us in very capable hands. So we are going to have Alyssa Williams and Jennifer Parrack from the Illinois Department of Corrections. They will be presenting this afternoon. Alyssa serves as the Chief of Programs and Support Services, and then Jennifer serves as the Reentry Administrator. Please help me welcome them at this time.
Good afternoon. We wish that we could be doing this with you in person, but we are so glad to be able to interact with you virtually on this level. We thank you, Rashonda, for the invitation to present. It's great to be back again for another year. The director sends his apologies. His schedule, as you know, is very tight, and he was unable to be with us today, but we will certainly try to fill his shoes. As we start, we wanted to talk about COVID just a bit because it's always on our minds, but COVID has certainly opened our eyes to really focus and look at things differently, hasn't it? IDOC over the last year has faced so many challenges, and we've adapted, and I believe at least that we've overcome the many challenges that have been presented to us. And we hope to highlight some of the wonderful things that we've been able to do over the last year in light of COVID. For those of you that saw me present last year, I presented on the transformation of corrections and how we have changed over the many years. And one thing that I brought to light was the implementation of a new reentry unit. It was a brand new concept for the Department of Corrections. And at that point in time, we had just named the Reentry Unit Administrator. So I am happy to introduce you, in case all of you have not met her yet, to Jennifer Parrack, the Reentry Administrator for the Illinois Department of Corrections. And Jennifer will be doing most of the presentation for us today. So I'm going to switch it over so you can solely focus on her. So hopefully I'm not giving anybody motion sickness.
Hi, good afternoon. Again, Jennifer Parrack, Illinois Department of Corrections, Reentry Administrator. I am thrilled to be able to present to you today. It's definitely a learning curve on this virtual platform as I look at my PowerPoint and myself on this presentation, but I know we have amazing DOC staff that is joining us today, and I'm beyond excited about that. But a lot of our government partners, our community-based organization partners, the advocates that we work with closely. So I am super excited, and I've heard just absolutely great things, and I know the day has been absolutely fantastic so far. So hopefully we will not disappoint, especially with Director Jeffries not being able to join us today. But I am also very, very excited to share the progress we have made around reentry in the Illinois Department of Corrections. We have a long way to go, but I think we have made some significant strides over the last year. COVID, in a way, has hindered a lot of our work and the grand plans that I had when I got into this position, but it's also given us the ability and support community statewide at the government level to really push forward fast, sustaining, significant change. So I am going to go through the PowerPoint that we had put together regarding just the basics of reentry, the changes happening in DOC, and I'm going to allow plenty of time at the end because there's always a lot of questions that we want to be able to get to and answer that you have around reentry and DOC as a whole. So I will go ahead and get started. All right. Okay. So DOC programs and support services. And you know what? I'm going to make one quick adjustment to my screen, you guys, so I can actually see my slides from where I'm sitting. So sorry about that. So programs and support services mission is the mission of the Department of Programs and Support Services is to provide a continuum of services for those committed to the Department of Corrections from the point of incarceration to discharge from parole, providing a system for the delivery of consistent and effective programs that meet the needs of the committed offender and enhance their ability to become a productive member of society upon release. So really, what does that mean? We really want to start reentry at the very beginning. When someone comes in our door, it's vital that we can assess them with a risk assessment, which we have began using within Illinois Department of Corrections, put a treatment plan and a pathway together for someone so they have a logical flow through the system that can meet their basic needs, but also the needs to support what they want to do when they go home, to be able to support themselves, support their family, and be successful on parole and thrive. We don't want people just to survive when they leave our custody. We want people to be able to thrive and be successful. So why focus on reentry? So in 2020, IDOC released 20,614 individuals from our custody. And I think I just need to let that sink in for a quick second. That is a lot of people moving through our system. To release over 20,000 people in 1 year onto MSR, we do have some that end up leaving our system, serving their parole time onto discharge, where we don't have follow-up services where they're on a supervision level. But that is a lot of people for our parole department to be able to supervise, manage, and assist. It's a lot of people. So what we wanted to do, more meaningful reentry and more meaningful focus before people go home. And really within that last 6 months to a year, focus hard on what someone needs when they leave. So as Chief Williams alluded to, they created the Reentry Unit in January 2020. And really to start, I was the Reentry Unit. That was it, just me. And since that time, the Parole Reentry Group, which I'm going to talk a little bit more about later today, ended up coming over to the focus under programs from parole on the Reentry Unit. And since that time, we've added 3 regional supervisors, Linda Gatson-Rowe in the District 1 Chicagoland area, Amy Burley, District 2, which goes over to the Rockford, Quad Cities down to Peoria area of the state, and Angie McConney, which is for the Central Illinois, which ranges from Danville, Springfield, Decatur, Champaign, all the way over almost down to Effingham area. And currently we do not have a supervisor in Districts 4 and 5, so I continue to oversee reentry as a whole, but also that area as well. So we're going to talk a little bit more about what reentry really means and how we put it into practice. But really the focus is better preparation prior to release and access to resources will assist in a successful transition. So we've always done reentry in DOC. We just want to make sure that we are more intentional in our focus on an individualized level. It is not a one-size-fits-all. We have people that come to us from all over the state, and we have people that release back to all over the state. We have all age groups. We have veterans in our custody, men, women, different education levels, from struggled to receive their basic high school, their high school diploma, GED, all the way through college educated individuals. So people's needs to be successful when they leave or while they're in our custody are different, and we need to stop treating people as one size fits all and make an individualized plan for someone around reentry. We also want to provide linkages and assisting the correctional facilities to parole. As we talked about earlier, 20,000 people leaving our custody, that's a lot for parole. And so we really need to be able to help parole step into a spot when the supervision, they get someone on parole for supervision or mandatory supervised release, they are able to help them be successful and support them in the work that they've already done while in our custody. Okay, so monthly release totals. So this is just a breakdown from 2018 to December 20 on how many individuals we left. So in December of 2020, we had 1,681 people that left our custody in the month of March. So as you can see on the slide, and I'm sure it's pretty small for some of you guys, we did have that bump where it bumped up over 2,000 in April of 2020. And I just want to touch on that just quickly. And that is really when COVID took off in our facilities, and we were able to reevaluate some of our procedures, our policies around being able to do some early releases from our custody through a variety of mechanisms. We were able to use earned discretionary sentence credit and releases on electronic detention, some medical furloughs for our high medical need individuals. And we bumped up those releases to be able to provide some ability to social distance the best that we can in our facilities, and really start looking at ways that we can help people do a smooth transition, possibly a little earlier when it was appropriate to do so. But you can see it's pretty consistent over the last 2 years on our releases a month. We release from all of our DOC facilities, which makes it difficult to be specialized around reentry when you're having that many releases from all our different facilities. All of our facilities do everything a little bit differently. So it's been a big focus over the last year, also on trying to streamline and be consistent in the things that we're doing. And we're going to talk a little bit about that today as well at all of our facilities. All right, so enhancing reentry services, the very basics. So we increased our gate money to $25 from $10. And I know a lot of people are thinking $10 is getting you nowhere. And we absolutely agree. When you have to travel between 2 buses to get where you're going, to your transitional housing placement, or until you can reach your friends and family, $10 doesn't get you very far. And so we did look at that and increased it to $25. I'm sure there's a lot of people out there saying that's not going to get you very far either. And I don't disagree with that, but it was one small step we felt like in the right direction to getting people a little bit, probably just a little bit more prepared, walking out that door, that immediate need to be able to get some food and be able to get to where they need to go. Individuals are released with 30 days of medication instead of 2 weeks. This is one I felt very, very strongly about and advocated very strong about. I received a lot of phone calls from our great partners and community-based organizations that were working with people when COVID really first happened in April and May, or March and April, and Secretary of State's offices were closed and people couldn't get their state ID. We had long waits in our hospitals, at our emergency rooms, at our mental health centers, at just our health centers in general, or people were scared to go into those places. And when they left with 2 weeks of medication, they were running out and they couldn't get their script filled because they didn't have their state ID. So it compounded just little issues we were seeing, but when you put it all together, compounded to a major issue and a safety factor for our men and women that were leaving. So we now release with 30 days of medication and a script. I was very, very happy about this change for DOC. And from our community partners, I have heard there's a lot of good feedback around that as well. We've increased Medicaid enrollment across all facilities. And this is one we still have a long way to go on, just navigating the system. So even for us as staff to learn that system and navigate it was very complex. So now you expect people leaving our custody to be able to navigate multiple complex systems to be able to get their right documents and do this. We realized that it really needed to start earlier in our process before someone's released. And Amy Burley, one of the reentry unit team members, has been absolutely instrumental and done a fantastic job of providing statewide training to our DOC staff to be able to help men and women enroll in Medicaid prior to release. We have also worked on updating our systems so we can track that as well and make sure we're identifying where we're dropping the ball and it's not happening, and continue to make sure we're doing quality improvement on it and checking it and assisting people. Some of the struggles we have is sometimes those early releases when earned discretionary sentence credit is awarded or someone's awarded earned program sentence credit. So we're still figuring it out. We have a long way to go, but we've made huge advances in being able to kind of coordinate and calculate people's time with the work they're doing, the programming they're completing, to make sure we're not missing those things, because they become a safety factor for people. We want people to be able to access the services that they need when they leave our custody, and that's one step in that right direction. SNAP enrollment is happening currently at Logan Correctional Center. We've had amazing staff there that have worked really hard to partner with DHS and make sure that that's been able to successfully happen for our women leaving custody at Logan Correctional Center. I'm excited to announce we will be rolling that out to 2 additional facilities later this month. So we are going to be starting this process in the men's division as well, with a goal to eventually roll this out statewide and be able to give this service and access to all our men and women across our facilities. Our reentry resource rooms with limited computer access being implemented at IDOC facilities. So this is one that started about 2 years ago at Kewanee Life Skills Reentry Center. And we had a lot of learning to do about how do we provide access to our men and women eventually, but our men at Kewanee to be able to look for jobs, to be able to access services. As you know, in the digital world, as I present to you virtually today instead of in person, this is the way things are going. This is the way things were going prior to COVID. Nobody is filling out paper job applications anymore. So we have to be able to prepare, as part of reentry, our men and women for the virtual world they're returning to in the community and be able to navigate and apply for jobs online. So we had a reentry resource room created at Kewanee Life Skills Reentry Center. And since then, we've been able to work with Do It and get approved whitelisted websites, so approved internet sites for reentry services. And we continue to review them and add to them on a regular basis. But now all of our DOC facilities have computers that we've ordered specifically for this mission. Just a few at every facility, and our facilities are working hard to put their reentry resource rooms together. Just this last week, the reentry unit delivered 4 boxes. A few facilities are still getting their boxes. Actually, 2 are getting delivered today, full of reentry resources. And then we've also put those from those boxes that we've delivered to people on our intranet. So our staff have all of the resources in one place. One thing I've learned over the last few years is we send out memos, we send out emails, and practices, things get missed, or you're always digging for where's that information at? Where's that? What's the form we use for that? And so we're wanting to put it in one centralized place so we have easy access for our staff to be able to pull from. Statewide reentry guides and regional resource guides are provided upon release. So if anyone today wants to get on our DOC website, we actually post those under the reentry tab. So if someone is out of our custody and they need something from one of their counties or want to utilize one organized resource, they're able to go there. We also have those on our intranet and will be available in our reentry resource rooms for all of our men and women. So state ID pilot at Lincoln and Logan Correctional Center. So this was one that actually was born out of restrictions we had during COVID. Secretary of State's offices were closed. We were continuing to see struggles on people leaving our custody without their state ID. So we partnered with Secretary of State, a lot of emails, a lot of calls. The ultimate goal we both had on both sides was, how can we get people the documents they need so they can go out and get their medication, get their scripts filled, be able to access medical services, and be able to get a job. You have to have an ID to be able to get a job and to be able to start working. And that's what we want for our men and women when they leave, for them to be successful. And employment is a big piece of that. So we started working a process out where we could, with the approval of the individual, share their vital documents as you would need when you walked into a Secretary of State office for their state ID, and they would be able to provide their state ID. So we are working on that being able to happen before someone leaves our custody. We were able to do that in a very small number at a few facilities, and we will be starting a new process in April at Lincoln and Logan, with an expansion out to Kewanee and Lawrence in May. And we're super excited about that. I cannot have asked for better partners with the Secretary of State for this process. It really will help speed up that extra step someone needs to take, or a system they need to navigate when they leave our custody prior to someone walking out the door. And we no longer have a time frame to MSR or parole for birth certificate requests. So when I stepped into this role, it was 180 days, or actually 90 days, with the Cook County Clerk's Office. So what happens, we were missing people that would get earned discretionary sentence credit or earned program sentence credit with contract. They would have that request out, they would be gone, birth certificate would show up at the facility and we'd have to send it to them. So now the fact that we can start that process way before they're released allows us to not miss those people as they start getting closer to their out date when things could change. So we've been focusing on requesting birth certificates for our men and women that are a year out from release. Again, we still have some barriers with things. We can't necessarily get a copy, I'm going to make correction, Illinois birth certificates. And that is one they're able to get free of charge. We still have continued to make partnerships. People can request theirs if they're out of state, and we still work hard to help people get their birth certificates, but just a very vital document that you're going to need to be able to be successful when you leave. Okay, I'm going to move my slide, and I was talking a little too much and it timed out on me. So give me just a second. There we go. Barriers to release due to COVID. So I talked a little bit about this already, but one of our barriers was inability to refill prescription medication due to no state ID. And again, this is one when I'm fielding those calls and I'm talking to our partners in the community that are really on the ground, front lines trying to assist people, this is an immediate need and desperate need for our men and women. So our response was to increase medication to 30 days and collaborated with the Secretary of State to process state IDs. Again, this is where we hit this barrier. We always knew it was a challenge, but not quite as immediate as it became under COVID. And we were able to come together and address this barrier. Ensuring individuals have medical coverage and access to community-based resources. Again, we've done a lot of statewide training and increased Medicaid enrollment pre-release and sent out statewide regional resource guides as well. So we want people to be able to access the information and have access to information. So a lot of it was just one organized place and being able to give our men and women access to these things. And I really will touch on that a little bit later about being able to give people opportunities to access resources. All right, so collaborations with other state agencies. This is one that I have seen over the last year I've been blown away by, where we are all joining meetings together, and it's not just joining meetings to talk. I feel like there's action steps happening. There's things that are getting accomplished that are beneficial for all involved, especially beneficial for our men and women. And I didn't have it in my slide today, but I absolutely need to touch on the point that I feel like more than ever in these conversations are men and women that have had lived experiences, that have moved through our system and come out and struggled or been successful or struggled and then have found a way to overcome it, are at the table, which is, I feel, really, really important. And Cook County Workforce Partnership, I have to highlight the great work you're doing with our facilities around workforce development, but my hat is off to you to be able to hire navigators that have that lived experience, that can connect with our men and women at a level that a lot of us can't and know what that daily struggle is like. So before I talk about our state agencies, I just think that is probably a theme you've heard today, and I will continue to encourage you to have those conversations with our men and women that have been in DOC, that continue to be in DOC, and listen. I learned a lot when I was at Kewanee from our men there and the struggles that they've had and what their hopes and motivations are and how they have been able to navigate the DOC system or the parole system previously. So collaborations with other state agencies, IDPH, they assist us in a variety of different ways. Processing of birth certificates requests for counties, every county in Illinois. Partners in running our Summits of Hope, which are part of our partners with parole that we run for our men and women on parole, and HIV education in our IDOC facilities. And we're working on some other exciting things coming down hopefully soon with our partners at IDPH. Secretary of State, as I talked about, processing of state IDs, that will be expanding in April with the new process. HFS is our Medicaid enrollment and working with the PASS screen process for high mental health and medical need individuals. We've seen an increase over the last few years of our men and women having high medical and mental health needs in nursing home placements when they leave our custody. So we are working with HFS. They've done a fantastic job in being partners with us to be able to streamline those evaluations, and ability to even do the evaluations is just the first step for us to be able to identify the needs someone needs and then what could be the appropriate placement for them, which is really important for the safety, especially of our high medical needs individuals. DHS, the Supplemental Nutritional Assistance Program, SNAP enrollment, they've been great partners to us as well. So one thing I want to highlight, which is not something we usually get to highlight in DOC, is our use of technology. In the reentry resource rooms, we're going to be able to complete some of these applications for Medicaid and SNAP through a digital format. So to be able to use our computers in our resource rooms to enroll people in these instead of doing a paper-based application. It's no secret, we love our paper in DOC. As I sent out boxes full of paper just recently. But at this point, we are trying to move to a more digital format and be able to complete those applications like most people would in the community, not on a paper base, but digitally. All right, housing efforts. Transitional housing solicitation for general housing and services. So we were very, very lucky to receive federal funds to help support our housing efforts through COVID. And so transitional housing we have out on bid buy, and housing solicitation for severely mentally ill, which we also have out on bid buy as well. Our hope is to be able to expand out our housing ability to provide transitional housing and services for individuals in districts 2 through 5, so outside of the Chicagoland area, for just general transitional housing, and then be able to provide and expand out our housing ability and services for our severely mentally ill statewide. We are in desperate need of services in the central southern part of the state where there's just really been a drought for a long time. Which ends up happening is we have to be able to place people in approved housing prior to someone being released. And we want to make sure they're able to go back to an area that is the right fit for them with employment they may have. So it's important for us to really look at all areas of the state to be able to provide housing and resources for. We have a lot of strong partners around the state. We tend to have our most resources in Chicago. And that being said, we send a lot of men and women back to the Chicagoland area. So there is a need for those resources, but we don't want to forget about the rest of our state and to be able to support our men and women in the central and southern part of the state. So we have a couple housing pilots that have really been developed through strong partnerships and foundation support as well, which is really fantastic to see people coming together to address these issues. And that's the housing pilot with the Illinois Housing Department Authority. And that is one where we have been able, and I'll actually talk about it just on the next slide. So I'll go through the rest of the list. Housing pilot with the Illinois Justice Project in partnership with Safer Foundation and TASK, 2 of our really strong community partners. And then a need for transitional housing outside of the Chicagoland area, which I actually already addressed. All right, so the Illinois Housing Development Authority was an interagency initiative through IDA and IDOC, and it has the ability to help us screen individuals leaving IDOC custody or actually already in approved transitional housing that can move into we can screen that would be the right fit to move into an apartment that is possibly for up to 1 year, but does work on a sliding scale once they get employment. And we left the opening very open, the ability to right to work, the ability to work, and we looked at an age range of about 35 to go into that. And it was $3 million over 3 years for housing placements for 75 participants. So this is really the pilot that we focus on. What does it look like for someone to be able to not just have 60 days or 90 days in a transitional housing, but what does that long-term stable housing look like? To be able to provide that where someone can really get on their feet, take a breath, and not have to worry about their housing for 6 months, 9 months. And then as they start being able to get working and get going, then that slow sliding scale to be able to ramp up. And what I love about this pilot is we weren't just focusing on one bedroom, one individual. There was a lot of care and thought around being able to support people that have children, that have families in multiple bedroom apartments. So it's just been really exciting and has a vast area of the state that we run this pilot in. One thing that was super exciting was NYU joined us as well. in this pilot, and they were able to provide funding for house furnishings for all of our participants. So just the general furniture, plates, silverware, stuff like that. So all the things you don't really think about that we just kind of naturally are able to navigate and get. You have a job when you move. Think about walking out of a DOC facility, going to an apartment. You're just trying to figure out how you're going to go get your ID, how you're going to start looking for a job, how you're going to get any of the other things you need to get going, reconnect with your family if you have that option. You're not thinking about, oh, I need to go get plates to eat off of, or where am I going to sleep? What bed am I going to sleep on? Am I going to sleep on the floor? So NYU really stepped up in our partnership on this pilot. All right, so we officially launched this in July, and it's 7 counties that are represented in this pilot. So you have Winnebago County that has 20 spots, Boone, which has 5, Stevenson 5, Champaign, which has 15, and Suburban Cook that has 20. Now, the city of Chicago has its own funding source for this, and Lake County, which has 10. Again, we are roughly, let's see, we have 17 currently placed, with 5 pending as of February 16th. So I'm assuming we have placed a few more since then. And we continue to screen on a regular basis for any eligible individuals that might need a place to go and have an apartment. All right, Illinois Justice Project Safer Task. Privately funded housing pilot with heavy focus on the parole population that lose their host site. So we really shifted focus a little bit. When we started, it was really looking at maybe some early release individuals going out of DOC custody, and we still look to serve those men and women or just needing a place to go. But what we found out when this pilot started was we were having a lot of safer and tasks, having a lot of touch points with people currently on MSR parole. They were doing well. They were doing everything we're asking them to do. They're getting a job, but they're having housing instability, which is a huge thing. I don't think we actually quite know the level of housing instability our men and women face, because they may be sleeping on a couch. They may be sleeping on the floor in some places. They may be in an apartment with a cousin, a family member, a mom, a grandma, and there's 5 or 6 other people also staying there. So again, it becomes just having a roof over your head is so important and vital. But what does that really look like? Is it conducive for you being successful as part of your reentry? So they really stepped it up on this and started working with a lot of those men and women as they struggled with losing a host site or needed to transition out of the DOC transitional housing, and were able to help them find an apartment. And I will tell you, both these agencies have hit the street as far as trying to find affordable housing for men and women, and they've really ran into a lot of barriers and struggles around people, just that mentality of not wanting to rent to someone with a criminal conviction. So we've had a lot of conversations around that as well. So their rent is covered for 6 months, and they have a case management component with it that also assists them with wraparound services. So Safer Foundation covers the Chicagoland area. We currently have 7 individuals placed with them, and that may have gone up since I put this together. And TASK covers the rest of the state, and they've had 12 individuals placed so far. Another thing I want to highlight is they have not closed their doors or said no to anyone based on their criminal history. And that is something we continue to face and have difficulty with, is people want to take individuals that maybe don't have violence in their background or don't have some of the high needs and special populations that we need to be able to assist. And this is one where both of these organizations have done a really good job in this pilot of saying, we'll work with who needs our help, and we will find a way to make it work. So we're grateful for that. All right, the Parole Reentry Group, also known as PRG. Back and forth name, we've been Placement Resource Group, we've been Parole Reentry Group. Since I've been at DOC, they've had a variety of names, but I will say this, no matter what name, Parole Reentry Group is what we have, and what I'm saying today under reentry, their work has not wavered in what they do. And I don't think quite people always understand what they do, but I think they have one of the most difficult jobs in DOC. Their job is, no matter how quickly it is to someone walking out the door, or if they have a few weeks to work on this, if someone doesn't have a place to go, it's their responsibility to find a place for these individuals to go. And again, with limited resources around the state and some of the special populations, individuals that have sex offenses in their background, high mental health needs, high medical needs, placements not wanting to take people with certain backgrounds or needs, they really have to do a lot of networking and a lot of hard work, especially on some of our non-paid placements and partnerships that they've been able to create and form, which is vital for us. As you guys all know, we don't have unlimited money. A lot of you guys sitting out there today do not have unlimited money either for the resources and things that you need to do or that you want to do. So our partnerships they've made through some of our non-paid placements is vital, but they also monitor all of our paid transitional housing contracts as well. The unit has 16 full-time casework supervisor positions. And again, they work with the facilities, they work with parole. If someone's on parole and loses a host site, needs a diversion, that's who parole calls, is our PRG staff. So they really they bridge that gap, helping people get out, but they help people stay out as well, and work with parole. They do a lot of partnership with our community stakeholders and our men and women out on parole. And we get a lot of letters from our men and women leaving custody as well, and on hopes that they have or trying to get to a certain area of the state to maybe get a fresh start or to be able to go back to the resources and jobs that they have. All right, so we have PRG offices, and they are paired with our parole offices in Chicago, Rockford, Peoria, Springfield, Decatur, Champaign, Effingham, Marion, and East St. Louis. Housing is by far the most sought after resource managed by PRG. That continues to be a constant theme for us at DOC, for people that have been able to sit meetings with Chief Williams, myself, is our need for more housing and housing that can provide higher level of services. Housing is, like I said, by far most sought after one. Monitoring is a crucial factor. So they also do site visits to monitor our transitional housing. We want to make sure that that we're contracting with our housing providers are providing a clean place to stay, a safe place to stay. They have the ability to provide the services that we've contracted them to provide. That can be transportation, it can be mental health treatment, it can be anger management, workforce development is another big one for us. So they do monthly site visits and reviews. So that is one thing you're working really hard on over the next year, and we have over this last year, on how can we be more efficient in how we do that? How can we make sure as we bring on new housing vendors, be able to get the resources that we need for our men and women? All right, challenges to housing placements. Homeless individuals, individuals with moderate to severe mental health issues, individuals with mandated GPS monitoring is a big one for us. Individuals with sex offenses and convictions, and offenders with medical issues. As we have an aging population in DOC, more than ever, we're seeing our men and women struggling with high mental health needs, needing nursing home placement. Dementia is another one that we are starting to see an increase in. Mental health will say this is medical, medical say this is mental health. We're trying to find placement, and we're just not getting anywhere. It's one in a group of individuals that we really, really are having a hard time with, helping navigate the system to get them somewhere upon release onto their parole. All right, so I just want to talk a little bit about numbers, so you know the context that what we're working in with PRG. So between 3/23 of 20, I started tracking. Really was when the start of COVID. And I cut it off to 2/14 of 21. So our total placements through PRG were 3,326 individuals that were placed with those 16 casework supervisors. So, the amount of work that they're doing in placements on a weekly basis is high. So that was placed there. Of those were paid placements were 2,499. So our average placement is 60 days in length. And I know you're all thinking, 60 days, what can you get done in 60 days? We don't disagree with you, but currently right now it is 60 days with the ability to grant an extension as long as the individual is meeting the needs of what they're supposed to be doing. And there is a really solid identified need for them to be successful and continue with their successful transition for that extension. So we can do extensions up to 180 days. I will tell you, I signed off on those extensions. I signed off on a ton of them during March, April, May, June. We're seeing a little bit more reduction, but the main reason we were seeing is people just didn't have the ability to be able to get a job, to be able to have money to support themselves to transition to an apartment or another stable living environment. So that's something we addressed. I worked with Chief Williams, I worked with Fiscal here at DOC, and we weren't putting anyone out on the street. So non-paid placements, 619. And for that is a lot of our partners that we are very thankful for have different time frames on how long someone can stay. So it can be on some of those, their program, they're willing to accept our men and women as they leave on parole. They can keep, it can be whatever time frame really that they want, but we have some really great partners. Increase in extensions, like I said, as I talked about, and we've also seen an increase in diversions due to loss of private host sites. Someone may become COVID positive, someone's trying to leave the house. So we saw a lot of diversions over the last year. All right, population management, updated policies and procedures in 2020 to reflect a more program reentry focus. This is one around ED, earned discretionary sentence credit, electronic detention, and our use of adult transition centers. We really have increased our ability to review and approve what's considered exception to criteria placement. So individuals that would have served long-term sentences in Department of Corrections with higher level convictions that have done well in DOC are looking at their ability to step down into a work release center. So prior to this, we had a very multi-level review process. It's now been streamlined to review through the programs and reentry unit. So Chief Williams and I both have a lot of responsibility in that for the final approval for people in those areas. And we have seen an increase in the use of all three, which is really great for people that are ready to go home, possibly a little early or on a electronic detention, or to step down into our adult transition centers. Okay, so what's next for reentry? So I will tell you this. I had a really grand plan when I stepped into this role in January 2020 with a huge focus on workforce development. I was going to get all of our employers on board, just really had big goals for vocational training, and again, just partnered employers, and COVID hit and it all stopped. And what I realized during the first few months into COVID was we need to back up. We're not even necessarily doing the basics all that well. So let's take a step back and look at some of our policies, our procedures. What can we enhance and do that we do already and improve it? Or, even from changing the medications from 2 weeks to 30 days, our gate money, or giving people access to more resources. Do I think we overwhelm people with paper right now when they walk out the door? Absolutely. So we're working on that. There's a team of us that are working on that. We have some fantastic field service reps across the state that are on that team. And I will say they are some of the hardest working people in Department of Corrections. I've had a lot of lessons around what all exactly they do since I wasn't a field service rep, and it blows me away, the work that they do. So we have a great team together working on just the basics of how we can make the release procedure more streamlined and make sure we don't miss things, but we're working backwards. We want to start this process much earlier, and it partners with programming enhancement happening in our facilities. And I know a lot of you probably got to see Chief Williams present last year, and just the work she's doing on the program side fits so nicely with reentry. I say all of that to say my grand plan from January 2020 when I stepped into this role is now going to be one of my focuses in 2021. We really are going to work hard on trying to bring employers to the table to work with DOC and work with our local workforce areas to help us with the employment piece. We provide some fantastic vocational training across the state. We have very talented men and women in our custody that come to us with great work experiences and training, but we've also been able to provide a lot of that while they're in our custody, and we want to make sure that they can be successful when they leave, and part of that is employment. We want to build out a rapid reentry program to address the immediate needs of individuals that have less than 1 year left to serve in DOC. This is one I feel pretty strongly about. We're very scattered across where people are housed in DOC. We may send someone from the Chicagoland area to the very southern tip of the state to one of our facilities, and they have 3 months. Depending on the wait list at facilities, they may not get access to a lot of programming. So I'd really like to see a few specialized places where we can really focus strongly on reentry and for those quick turnarounds that happen for people. If we have someone for 4 months, 3 months, 6 months, what is the meaningful services we can give them before they're released? And we want to expand housing opportunities for men and women in Central and Southern Illinois and continue to focus on men and women with high needs and high populations. Okay, supporting successful reentry. So how can you support successful reentry? So supportive housing, reentry councils. So I've had the opportunity to see quite a few different areas of the state form reentry councils. So we love being at the table for those and being part of those conversations. But definitely, I think there's a lot of people out there today that I'm to that are part of these reentry councils, or you're in an organization that is doing this work already. So how can we make it more collaborative with the state, within your region, with the different providers? Next week, I get to go out to an area of the state over in the northwest area of the state where the sheriff's department is driving it. They're bringing together so how they can support men and women coming back from custody. How can they help support people so they don't come into our custody, stress their needs? I love getting those phone calls. I like being in those conversations. We want to support that work as well. So employer engagement and commitment to hiring and returning citizens. And again, I talked a little bit about Cook County Workforce Partnership is doing a lot of great work around this. So are a lot of the other workforce agencies across the state and the Illinois Workforce Board. Again, we're looking for employers that want to make that commitment to hiring our men about the vocational programming that we offer across the system. And that is all I had. Chief Williams, did you have anything else before we close it out?
We're going to give you motion sickness one more time. Sorry about that. I wanted to thank Jennifer as well as all of her staff for all of the hard work they've done. Within the last year, it's been truly amazing to see the remarkable changes that we've made within those reentry units, and I attribute it to her and her staff. I also wanted to thank you for all of our community providers who are vital to the success of our population of men and women, both inside and out. We could not do this good work without you. I would continue to ask for your assistance as well to help us with all of our endeavors, because it truly does take that collaborative work to really make this a good success. But Jennifer has a wonderful thing to close our session with, and then after she closes, we'll have a few minutes left to take some questions.
Okay. So just today, as I was kind of sitting in my office working this morning, I really was thinking about just the last year around reentry. And actually, I took a step back, and in January of 2017, I had the opportunity to be the assistant warden of programs at Kewanee Life Skills Reentry Center. It was a brand new DOC facility that was opening. It was previously a DJJ facility, and I really got a clean slate. DOC said it was going to be a reentry center, but we got to create this program from scratch. I mean, we knew what we needed around reentry. At least I thought I knew what we needed around reentry. And I will say, I learned so much in that first year. We had a lot of men that came into Kewanee that had served significant amount of time in DOC. They had seen the swings, the shifts in programming, no programming, and they were very vocal, but they were very vocal, and they were just so excited by the opportunity to have a voice. For anyone that is familiar possibly at Kewanee, we started 2 roads and easing that the Bennett Kewanee right, and they put out statewide to all of our DOC facilities through our tablets, but they also are posted occasionally on our DOC webpage as well. And I talked to our communications director this morning. She was going to put some of them back up. There's one up right now, the vaccine issue that they wrote, but they also wrote a very powerful one on race that I encourage anyone, and I can follow up, make sure we get it back up, to get on there and read it. Very powerful messages, just of hope, but of struggle. And I think it's so vital to be able to give people a voice, but to also give people opportunity. And as I was kind of thinking about Kiwani and what I learned from talking to our men there on about how to do good reentry or what we need to move our system to, I pulled 2 cards down off my shelf and I thought was really important. And the first one said, Ms. Parrack, I want to say thank you for all of your hard work and for letting me be part of your program. I did not deserve to be here, but I am grateful. I tried very hard to be successful in this program. I wanted nothing more than to succeed and to thank you and your amazing staff. I believe I never have been more ready to go home. And I'm not going to read the whole thing, but he did deserve to be there. Just because he had struggled previously, coming in and out of DOC doesn't mean that he's not worthy of the opportunity to be able to be provided programming and vocational training. He was able to be part of our welding program, and just really for him to walk out that door. And I actually was at the front gate when he left, and his mom was there, and she just said, he's a different person. The opportunity, and we're not giving them a whole lot of stuff. I mean, we're giving people opportunity to be part of programming and vocational programming and getting people ready to go home. And I wanted to touch on that one because I thought it was important, because people are worthy of the opportunity, even if they can't see it yet. And that's our job to make sure that we provide it. And the other one is a card, and it just said, Ms. Parrack, I am presenting you this card to show my appreciation and to speak up for those with no voice. And I think, and then he goes on to talk about helping me understand what it was truly like to be helped. And I think we do have so many men and women in our custody that do not have a voice or haven't found that voice yet. And so I always told the guys at Kiwani, when you get your opportunity to be your own biggest advocate, you are going to drive your success. We can give you opportunity, but we can't make you be successful. So I think the 2 things I want to end on that I continue to remind myself on is we have to be able to give people hope, and we have to be able to give people opportunity. So thank you. All right, so I think we have some questions if I can read them. Okay, what other types of digital services do you hope to provide with the computer rooms in IDOC, and how do you plan on collecting community resources to share? So great question. We have a ton of websites that we're able to post on there right now. Again, we continue to make sure they're appropriate to do so. And as we can, we will continue to add them. If you have community resources that we're not already sharing in DOC, I would encourage you to look at our DOC webpage under the reentry and look at the regional guides to make sure your resources are already on, your name and number is already on there. If it isn't, please email me so we can add it. We also have folders in our reentry resource rooms where we've started to put, so if your community or your organization would like to have a flyer in that room where someone, when they're visiting that room to help prepare for going home, can take one with them, please let me know and we'll be happy to do so. All right, any other questions? All right, I think that's it for Chief Williams and I. So thank you very much, everyone. Enjoy the rest of your conference. I hope you are able to take some valuable information away. If you're interested in speaking with me, Jennifer Parrack, more about reentry that's happening in DOC, being able to help support the work that we're doing. I'd be more than happy to speak with you. Shoot me an email, and we will set up a time to meet. So thank you, everyone.
Thank you so much, Chief Alyssa and Jennifer, for that awesome presentation. Super great learning about some of the reentry programs occurring at IDOC. And I think one of the powerful takeaways for me was definitely that collaboration is key. So at this time, we're going to proceed with our afternoon breakout sessions. And again, they're going to be just like this morning, where you will have the opportunity to select the session that you wish to attend. And we have some really great sessions that you can find in the tab at the top of your screen. We will have 3 sections around putting people at the center, public health and public safety, a timely connection, and compassion, a gendered response to emotional resilience and wellness during the pandemic. Immediately following these sessions, we ask that you return back to the main stage at 3 p.m. sharp for a special presentation by performance artist Grim Jackson. At this time, you may proceed to your breakout rooms, and we will see you back here in 1 hour.